It's a pleasure to be with you today to talk to you about the accomplishments of Community Hospital South during 2008. We saw not only great growth and financial success, but we also launched the beginning of Community Hospital South Next Evolution. This project will bring with it a new patient tower that will result in all private rooms for the patients and families of Community Hospital South. Community Hospital South had an exceptional year from a safety perspective in 2008, having completed our third year without event-acquired pneumonia and a complete year without a central line infection in the intensive care unit. We also launched the Culture of Safety program and educated all of our staff as relates to culture of safety, including our physicians. Community Hospital South saw growth with the beginning of our Center for Joint Health and the continued growth of that program on our campus. We had the good fortune at Community Hospital South in 2008 to be able to assist our friends to the south, Columbus Regional Hospital, during their time of distress. We were able to provide a facility and staff to assist them with the care of their patients over a 4 to 5 month time period.
In 2008 was our very first full year after our Next Evolution expansion. We have many accomplishments from safety, quality, HCAP score improvements, our response time for patients, our cleanliness scores, our emergency department diversion rates, and our patient throughput rates. Falls are reduced in many areas. I just can't tell you how proud I am. Our patient satisfaction comments are the best that they have ever been. The stories that patients and their families are telling about the care they receive at our institution are just inspiring.
We had an excellent year from an inpatient standpoint. We had an increase of 3.5% in our admissions over the previous year. When we look at some targeted growth, medical oncology grew 37%. When we look at cardiovascular, our cardiac exams were up 22%, our cardiac caths up 29%, and our cardiac and peripheral interventions, we performed about 170, whereas the previous year we'd done 68. Our community research organization participated in 15 projects. 4 of them were international projects. Thanks to our patient accounts people who enrolled uninsured individuals in the Healthy Indiana Plan. The Healthy Indiana Plan accounted for $2.5 million in revenue directly to our hospital. Our Anthem scorecard was 97%. Our SCIP indicators in surgery for CMS indicators were all green last year. We also received national recognition from the Center for Disease Control regarding our maternity practices in infant care and nutrition. Our performance was better than 98% of the facilities in the nation.
2008 was another phenomenal year at the Indiana Heart Hospital and for the entire cardiovascular team across the network. The Indiana Heart Hospital was honored as a Thomson Reuters Top 100 CV hospital, the only hospital in the state to achieve this award for the 3rd consecutive year in 2008. We also had another strong year delivering exceptional experiences to both our patients and employees. The overall rating of the hospital places us in the 97th percentile nationally, and our annual employee turnover rate was a remarkable 8.2%. For the 2nd consecutive year, the Indiana Heart Hospital met budgeted operations, achieving a 9.6% operating margin. Thanks to the work of many, on January 1st, 2009, Community Heart and Vascular initiated operations. Through the combination of CV physicians, 6 physician practices, the Indiana Heart Hospital, and Community Health Network, we've developed an organization whereby management is uniquely shared with physicians, creating a truly integrated delivery of care. Community Health Network CV Services continues to be the inpatient market leader in the 9-county area. Our first diagnostic cardiac cath was successfully performed in the new Johnson Memorial Hospital cath lab, casting the network's footprint further into Johnson County.
The intensive care unit at Community Hospital East recently achieved a major milestone in patient safety. They have been free of all VAP for 5 consecutive years. 3 new businesses were developed at Community Hospital East in 2008. The Joint Camp for Orthopedic Rehabilitation, the Seasons Unit for Adult Behavioral Care Needs, and the Moon Center. Each of these business units exceeded customer expectations by far. Through some exceptional efforts across many disciplines, Community East qualified as a disproportionate share facility beginning in 2008. This qualifies East for drug purchasing discounts of about $4 million annually. In 2010, we are hoping to be eligible for approximately $13.5 million disproportionate share revenue from the state.
In 2008, VEI ambulatory surgery centers performed a record number of 90,000 plus ambulatory surgeries. Not only is that a record for our organization, but it's 10% greater than we did in the prior year. In addition, the centers within central Indiana performed better than 55,000 cases, and those are up also better than 10% from the prior year. Maybe most remarkable is that we had one center, the Indiana Surgery Center South, performed a record 100 cases on a given day. Last year, for the 90,000 plus surgeries we did, better than 14,000 people returned a survey, which in and of itself is an accomplishment. Of those 14,000 people, 90% rated their surgical experience as excellent, and 87% of their families rated that time as excellent as well. In 2008, we opened a new surgery center in conjunction with Hancock Regional Hospital in Greenfield, Indiana, a partnership we've been working on a number of years. Also in Grand Blanc, Michigan, we started a partnership with the Genesis Health System and took over the management of a surgery center that they had this fall.
During 2008, CPI made significant strides towards becoming the premier primary care group practice in central Indiana. We experienced a 4.5% growth of our patient base, which now exceeds well over 225,000 patients. We also have made significant strides towards improving the experience of our patients, the quality of care we provide, as well as an exceptional experience for our physicians and our employees. For example, over 85% of the patients, when asked, indicated they would recommend their physician to friends and family. In addition, we've significantly expanded physician leadership throughout the organization. Of the 180 physicians, we have well over 55 physicians engaged at some level of leadership or decision-making throughout the organization. In a recent survey, our physicians indicated at a 42% rate that they strongly agreed that they would choose CPI as a practice site if they were to choose a new practice. This is compared to a national norm of 28%. We also, on our employee side, we have over 95% of our employees who have indicated that they would recommend CPI as a place to work for their family and friends. These are just but a few of the many accomplishments that a team dedicated to patient care has achieved in 2008.
2008 was a successful year for the Community Health Network Foundation. We successfully completed the North Capital campaign. We launched the South Capital campaign and provided over $400,000 in scholarships to support our community employees. I believe these three accomplishments reinforce our commitment to supporting the exceptional patient, family, and employee experience while supporting the physicians throughout the Community Health Network.
I want to share with you some successes of Community Home Health Services for 2008. The first is a new program that we developed with Dr. Dungy Poitras. This is a maternal-child program for moms who are at risk to monitor them in the home so that they are safe to stay home when they might go into labor early term. So this has been a great program, and along with that, we've added to that program Billy blankets for babies when they go home. The second one is telehealth has grown for congestive heart failure and COPD. Our congestive heart failure patients and our COPD patients are now able to be monitored in their homes so that we can make sure they're safe and we can work with their physicians to keep them in their home. Our satisfaction score this year for our team's loyalty is 99 percentile. This is a great accomplishment for our team. And last but not least, we had a tremendous financial project this year to redesign our billing and collection processes, and we were able to reduce our accounts receivable days 13.6 days.